Hi, this is Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida College of Public Health. Today is Thursday, July 23rd, and I'll apologize ahead of time. I'm trying to throw this together very quickly. It's going to be a hodgepodge of a couple of different things. My primary reason for putting this video together is I've gotten a lot of feedback about how people really enjoy the zip code level map that shows the number of cases and the rate of cases per 1,000 population, but they wanted some sort of historical purview. How is this changing over time? And so I wanted to just discuss a few aspects of what I'm adding to the dashboard today. So first of all, with the basic zip code level map, which is visualization number 8, again, you can hover over any zip code area and it gives you basic information, right? It describes what the zip code area is, the total population in that zip code, the total number of cases to date, and then the rate of cases per 1,000 population. And then, of course, it's a chloropleth map, so I've colored it so that the more red the color, the more common is the number of cases in that zip code per capita. And so again, you can do the same thing over here. You can hover over a zip code in the table and it will highlight where that zip code is, or you can just click on a zip code in the map and it will filter the table down to that zip code. So again, that was already there. What I have added, and hopefully this is something that, helps people. I don't want to overinterpret this kind of information, but I've downloaded, with the help of a USF archive, a repository of the zip code files dating back to May. And so what you can do with this map, and again, it's not numbered yet. I want to make sure people have value in it. But if you just kind of come over here to the filter and hit the play button, what will happen is it will start at May 10th, and you can see it's incrementing May 12th, 13th, 14th, and it will continue to run through all of the dates and show you how the cases are increasing. Because again, it's important to remember that each one of these slices at the day level, it's not the number of new cases in that day, it's an updating of the cumulative numbers. So you should only expect the cases to go up or the rates to go up. Sometimes that doesn't happen, which may seem like it's impossible, but I think they may assign a zip code to a case, and then once they do contact tracing, they may update that. So you may get, sometimes a decrease of 1 or 2 cases in a zip code area. But again, this is just something, and you don't have to wait on the the animation to go by itself. You can actually fast forward this thing all the way through to the end. You can stop it and pick any date of interest, or again, go as fast or as slow as you want through these visualizations. But again, if you want to zoom in to an area of interest, you can highlight an area, or again, you can just kind of zoom into your heart's content if you want to use the little plus sign over here, and then drag your area. So let's say I live in Hillsborough County. So let's say I wanted to focus in on Hillsborough County. And again, the hover-based tips, still work. It's just specific to a day now. So as we move forward in time, again, you can click through, you can click the play button, you can adjust the speed of all of this, but you can see how your community is changing over time and when you might be getting into certain levels where it's more common per capita. So I'm not articulating that very well, but again, it's just an animated map by day. There are a few dates that are missing, and that's just because the USF archive, as nice as that archive is, there's just a couple of days that we're missing. But again, hopefully this helps. What I think is more meaningful to that zip code level analysis is the other new animation that I've added. Again, it doesn't have a number yet, but this is going to have 3 different things available to you. It's going to have a map at the top left, and then when you actually interact with the map to select zip codes, you'll get more of an interaction on the right side. So let me show you how I intended this to work. Again, let me focus in on a particular area. I'll apologize that I always pick the Hillsborough Pinellas area, but that's what's most meaningful to me. And so let's say you were interested in just a couple of zip codes and trying to assess what happened over time. So if you click on one zip code, let's see what happens. So this is 33619. once you click on it, what you're going to notice on the top right-hand side is basically just a line that, again, remember, these are cumulative numbers. Each day is not the number of new cases, it's the updated cumulative totals. So again, we expect this curve to always go up, but the steepness in which it goes up can show you how fast cases are emerging in that zip code area. And then at the bottom, you'll actually see a table for that zip code that shows you the cases by day and then the rate on that day per 1,000 capita. And because I figured you'd want the most current information first, on the table at the bottom, I've sorted it in descending date order. So again, in this zip code, you had 867 cases to date as of today. Yesterday it was 840, the day before it was 831, and so on. Same thing with this graph. It's giving you the same information, just in a more visual way, and you can hover over any data point, and it will tell you what date you're actually hovering over, and then the specific information. So a little bit of redundancy, but I figure, some people like data in a tabular format, some people like it graphically. And what's really cool is, what if you wanted to compare a few zip codes in the same area? So if you hold the control button down and just click on, let's say we'll just do 4 different zip codes. And you may have your own reasons for picking zip codes. And again, you can kind of compare. The nice thing is this isn't cases, right? The y-axis on this graph is not cases because, again, the cases are going to happen where the denser populations are in general. So this is the rate, right? The cases per 1,000 population. Another way you can consider that is I'm looking at the frequency of cases adjusted for how big the populations are. So again, you can see, for example, this green one, which is zip code 33614, appears to be rising more steeply more recently than the other zip codes that I've selected. And again, at the bottom, it will update the table to only show you the zip codes of interest. If you then click in an empty area, it will just kind of remove all of the zip codes. You can hit the home button to go back to the entire map of Florida. And then again, you can drag and drop if you were interested in Dade County. Obviously, I'm not scrutinizing this very much, but let's just say I picked those zip codes. And again, what everything will do is then filter. Sometimes it takes a little bit of time. And again, you can get all of that information in the table and then also a graphic. And again, it might just help you to identify, oh my goodness, what's happening here. This is 33128. Seems like the rate in this zip code has been rising pretty steeply of late. So that's those visualizations. I also wanted to take, I've gotten a few questions about this, which is why I wanted to also address it in this video. And it has to do with the interpretation of the death data. And so let me come over here. This is going to be illustration. So basically visualization number 24. And so once it loads, so there are 2 tables that I've put together to understand this lag in reporting. And so I wanted to take just a second on how I use these 2 tables. So the top table is all about first focusing yourself on a particular day in which deaths occurred. So let's say this is 7/17 is what I'm going to focus on. And again, this is the date that the death actually occurred. And what I like to do with this top table is go from left to right and say, okay, again, for all of the deaths that occurred on July 17th, there were 2 that were reported on July 16th. And again, this is that may seem impossible, but sometimes I think the report that is released on a given day. So for example, if the report came out today, they're usually reporting on information from yesterday. And so that's what the date of report is. So again, something that comes out today, I'm assigning that a date of report of yesterday, but obviously there might be a few deaths that actually occurred today that trickle in. So again, the key is just watch how the number increases, right? It went from 2 to 13. And then to 24 and 33. And again, this is the lag in death reporting. Even though all of these deaths actually occurred on July 17th, we find out about them on different days. And so right now, based on what we know today, or yesterday on July 22nd, there were 80 deaths that occurred on July 17th. Now, what this tells you, because these numbers are continuing to increase on a daily basis, it means we're not yet done, right? All of these deaths that occurred more recently, we're still finding out about them. Compare that to if I were to scroll towards the bottom here, right? These are deaths that occurred on April 30th. Obviously, we're not finding out about any new deaths. So as you go from left to right, the number is not changing, right? Because again, we're not finding out today about any deaths that occurred on April 30th. We've pretty much found out about all of them, hopefully. And so that's what I do with the table at the top. The table at the bottom is a little different story. It's if I wanted to ask the question about, well, on all of the deaths that are reported on a given day, obviously we had a very high number today, 172. Not all of those 172 deaths that were reported today occurred today. In fact, very few of them did. Only 20 of them did. So if you wanted to know how those 172 deaths were distributed in terms of the date that those deaths actually occurred, you can now look down in that column. So again, 20 occurred today, 37 occurred yesterday, 21 occurred the day before, and so on. And so if you keep scrolling down, you can see that there's even a few, right? So some of these are on July 3rd, on July 2nd. So this is almost a 3-week lag in reporting of deaths that occurred 3 weeks ago, and we're just finding out about them today. So that was it. I've gotten a lot of questions about this. A lot of people pay attention to the lag in death reporting, and so I tried to reshape this. This used to look a little differently, but I know that some people want to first focus on a particular day of death and see how those numbers increase as reporting rolls in. Other people want to focus on, and I think that's the more valuable one, the one at the bottom, of all of the deaths that were reported today, did those deaths actually occur? And of course, I've got a visualization for that, but as more days roll in, the visualization can get a little funky or just hard to digest because there's so many different days. So that's why, to me, I personally like the tabular lookup. I think this is an easy way to interpret it. So that's it. Thank you so much for listening. Sorry this was a little haphazard. Talk to you soon.